Okay, so we've dealt with SPIES. We need to deal with another key aspect of SPIES, which is a little bit quite complex and varies from case to case. And that's the I, like I explained in the previous video. So the I intervention deserves a bit of more detailed discussion. So let's start. Let's talk about it. Remember I said the I could be urgent, or non-urgent. Now, in most interviews, you're going to have to deal with the urgent or emergency part of the I. Now, in that case, the main frameworks that you need is the A, B, C, D, E of resuscitation, or the advanced life support. For some people is BLS, for some people is ILS. So for most specialties, this would suffice, the advanced life support principles. So you need to be comfortable with A to E of resuscitation. Then you move down to other aspects that can rise depending on the individual case. So a patient would come, for instance, with myocardial infarction, STEMI and STEMI, you go that route. A patient could come with dissecting aortic aneurysm, you go that route. Yeah, patient will come with whatever it is, stroke, you adapt it. So this should suffice in probably most non-surgical specialties. For surgical specialties, it's useful to understand the ATLS protocol, which has to do with primary and secondary surveys. So the primary survey is probably similar to ATE. Then you have the secondary survey, which looks for a specific disease process in a trauma patient. So that's useful for trauma, very useful for surgical specialties, as well as A&E. In surgical specialties, you also need the CCRIPS protocol, which is the care of the critically ill surgical patient, oftentimes for surgical patients on the ward. And it has initial assessment, and then you make a diagnosis, and then you decide to offer treatment. Yeah. Then the other protocols here would be adaptations of the ALS for children, which is the pediatric advanced life support, and you have the neonatal advanced life support, depending on the role. So these frameworks you have to be aware, and they will be specialty specific. So if you say head to toe, for instance, if a patient is presenting with stroke, if a patient is presenting with stroke-like symptoms, if a patient is presenting with DKA, do not forget your ALS, and follow the scenario that way. If a patient is presenting with acute myocardial infarction, which is a popular, follow the scenario that way. The patient is presenting with suspected aortic aneurysm, dissection, follow it that way. Of course, surgically, if a patient is presenting with acute abdomen, trauma, hernia, obstructed hernia, strangulated hernia. So these are the frameworks for emergency. Yeah. So A to E. Now, sometimes you need a little bit more detail depending on the way the scenario is going. I've developed a framework called CHROME, which is part of the intervention. So after you've done your A to E, you quickly review your patient's charts, which is C. You take a focused history, which is for the H. You quickly review results, so blood results, radiological results. If they've undergone an operation or procedure, you review the operation notes, whether there is some information that would help you. Quickly review their medications. Key medications here are anticoagulant, blood thinners, and then quickly examine in a bit more detailed beyond, offer that you'd examine in a bit more detail beyond what you've done in the first aspect. Yeah, so with that said, excuse me, I have a little cough. How about the non-urgent patient? You go through a standard sort of history. So if you like, you use something called HIT. So you start with history, examination, investigation and diagnosis, and then you offer treatment. So this would be sort of like in a clinical type of scenario. So you can just see how extensive the intervention part could be depending on the specific case, of your SPIES protocol or your SPIES framework. I hope you found this, making it simple. Of course, it would vary from case to case, specialty to specialty, but in principle, this should guide you through just about any case in any specialty.